Today we discuss about classification of antimicrobial agent. It's also called as a chemotherapeutic agent. First we see the property of an ideal antimicrobial agent. It should have a powerful action against the microorganism. It should be specific in action. It should not be inactivated rapidly by tissue, enzyme or GI microflora. It should have a good oral viability and penetrate to various body tissue and fluid. It should have a long elimination half-life and not rapidly excreted by the kidney or bile. It should not favor the bacterial resistance and so the cross resistance. It should not interfere with the host immune mechanism. It should not show the adverse drug interaction with other antimicrobial drugs. It should have a no or short withdrawal time in food producing animal. It should have be easy available and cheap. Let us we start the classification of the antimicrobial agent. First variety of antimicrobial agent based on chemical structures. Uh, Antimicrobial classified in the various way. Uh, First we see the based on the chemical natures. Sulfonamide and related drugs, sulfadizine, diaminopyrimidine, trimethoprim, fluoroquinolones, ciprofloxacin, beta-lactam antibiotic, penicillins, cephalosporin, tetracycline, oxytetracycline, doxycycline, nitrobenzene derivative, chloromphenicols, aminoglycosides, streptomycin, gentamicin, macrolide antibiotic, azithromycin, roxithromycin, polypeptide antibiotic, polymyxin B, colistin, glycopeptide, vancomycin, nitrofuran derivative, nitrofurantoin, nitroimidazoles, nicotinic acid derivative, choline antibiotic, azole derivative, other rifampicin, lincomycin, spectinomycin, and gristophelin. Second variety of classification based on the mechanism of action antimicrobial agent. Uh, Inhibit the cell wall synthesis means activate enzyme that disturb the cell wall. Example of penicillin, cephalosporin, cycloserine, vancomycin, bacitracin. Second mechanism action is causing the leakage from the cell membrane means a drug that increase the cell membrane permeability. Polypeptide inhibit the protein synthesis means a drug that causing the lethal inhibition of the bacterial protein synthesis because of this protein material of the synthesis of the bacteria, and if inhibit the protein synthesis means is a kill or inhibit of bacteria. Example of tetracycline, chloramphenicol, erythromycin, and clindamycin. Cause the misreading of the mRNA code and affect the permeability. Example of the aminoglycoside. Interfere with the DNA function of the rifampicin. Metronidazole, metronidazole interfere of the DNA synthesis. DNA is an important material development of the bacteria as well as microorganism. For example of the acyclovir interfere of the intermediate metabolite. An intermediate metabolite is responsible for the bacterial development. For example of sulfonamide, trimethoprim inhibit of the DNA gyrase. DNA gyrase is responsible of the DNA replication, RNA and protein synthesis. Example of the fluoroquinolones. Here you can see the general mechanism of those antimicrobial agent are inhibition of bacteria or kill the bacteria. First of all, we see the cell wall synthesis. Uh, Cell wall synthesis is inhibited by the beta-lactamide antibiotic. Cell wall synthesis inhibited by the beta-lactamide antibiotic like the penicillin, cephalosporin, carbapenem, and monobactam. These are agents inhibit or kill the bacteria. Another antibiotic vancomycin, besidecine are also inhibit the cell wall synthesis. Second mechanism is a cell membrane inside the cell wall. That is also polymyxin me is inhibiting of the cell wall cell membrane. Polymyxin causing the uh, permeability of the cell membrane. Another mechanism action protein synthesis inhibitor, and protein synthesis inhibitor at the particular site of the ribosome. And ribosome mainly two type. One is a 30S and 50S ribosome. Some of the drug bind to the 50S ribosome that inhibit the protein synthesis like the tetracycline and aminoglycoside. Another drug those are binding to the 50S ribosome subunit, macrolide, clindamycin, chlorphenicols. Those antibiotics are inhibit the protein synthesis. And another variety of mechanism of action, nucleic acid synthesis. RNA polymerase enzyme is responsible for the protein synthesis. Example of the rifampicin. DNA gyrase enzyme is inhibitor of the DNA gyrase that inhibit the protein synthesis, and DNA is responsible for making the mRNA, and the mRNA is responsible for the protein synthesis. Third mechanism action in the nucleic acid synthesis is a folate synthesis is responsible for inhibition of the DNA, RNA, and protein. Sulfonamide and trimethophan are inhibit the folic acid synthesis, which are the responsible for the DNA, RNA, and protein synthesis. Now we see the type of organism against which primary active uh, infection occurs by the bacteria, and that time doctor prescribe the antimicrobial drugs, means antibacterial drugs like the penicillin, aminoglycoside, erythromycin. If infection or disease caused by the that viral, then infection treated by the antiviral drug acyclovir. Infection causing by the fungus, due to this time that we are using the antifungal agent, glycosphingolin, amphotericin B, ketoconazole. uh, Disease occur by the protozoa, like that time we are using the antiprotozoal drugs, metronidazole. And disease occur by the helminth, and that time we are using the anti-helminth drug, pyrantel and albendazole, and etc. Now next is a classification based on the spectrum of activity. Narrow spectrum means narrow range antimicrobial are active against the few class of an organism. Narrow spectrum means narrow range antibiotic are active against the uh, few class or specific against the specific organism. That is called as a narrow spectrum antimicrobials. Example of penicillin, streptomycin. Broad spectrum means antimicrobial are active against the wide variety of organisms, and this type of antibiotic is called as a broad spectrum antimicrobial. chloramphenicol, erythromycin, and tetracycline. An extended spectrum and is the term applied to the antimicrobial that effective against the gram-positive and gram-negative bacteria. Uh, Example of the fluoroquinolones, cephalosporin, those agents capable of the acting on the bacteria as well as protozoa. Next variety is a type of action. Drug produce the bacteriostatic as well as bactericidal activity. Bacteriostatic means inhibit the growth of bacteria. Example of the sulfonamide, tetracycline, chloramphenicol, erythromycin. Some drug is a produce the cidal effect, and cidal drugs means that kill the bacteria. Example of penicillin, aminoglycoside, polypeptide, vancomycin. Here also some static drug may become acidal at the higher concentrations. Classification based on source according to the origin and drug may be classified. Agent obtained from the fungi like the penicillin, cephalosporin, gracioflavin. Agent origin from the bacteria polymyxin, colistin, bacitracin. Aminoglycoside, tetracycline, chloramphenicol, macrolide. Uh, these are the agents obtained from the active micelle. Now we see the choice of antimicrobial agent. First factor is a organism related factor is a target organism. Choice of antimicrobial agent uh, choice should depend on the peculiarity of the organism, drug, and host. And the first factor is organism factor is target organism. Identification of target organism is a first step toward the selection of the antimicrobial agent. Second factor of the organism is a selective sensitivity pattern. In some case, bacterial sensitivity become important to select a right antimicrobial agent. Drug related factor first is a spectrum activity. When target organism has been known and its sensitivity determined, a narrow spectrum antimicrobial that selectively affect that concerned organism is preferred over the broad spectrum. Second factor is related to the drug's type of activity. Selection of the bacteriostatic or bactericidal drug depend on the certain organism. Bactericidal antimicrobial agent may be preferred over the bacteriostatic drug in the treatment of life threatening condition or and impair the host defense mechanism. Pharmacokinetic profiles is also important factor in the drug related factor. Pharmacokinetic profile determine the effective concentration of drug at the site of infection is a determine the effective concentration of drug at the site of infection. Route of administration. The availability of the drug preparation determine the drug selection in many instances because not all drugs are available for administration by the all route. For critical ill patient, parental route is a prefer. In oral administration of the antimicrobial is a prefer for the longer term administration, or when target is a GIT infection, we can choose the oral administration of we choose the oral administration. Relative factors, relative toxicity, antimicrobial drug uh, very consideration in their toxicity potential. Penicillin are among the least toxic of the all antimicrobial drugs, and they should be preferred over the aminoglycoside and chloramphenicol. Antimicrobial policy selection of the antimicrobial agent depends on the predetermined policy that development of the bacterial resistance to the antimicrobial drug may be minimized. Last factor of the drug related factor, cost of therapy. Several drugs may show the similar efficacy in a treatment in the treating an infection, but very wide in cost. In the such case, a less costly drug should be preferred. Host factor, first is a host defense mechanism. Elimination of the infection organism depend on the integrity of the host defense mechanism. Pathological conditions like the renal disease, hepatic dysfunction, meningitis alter the response and toxic potential some antimicrobial agent. And local factors like the pus, hematoma, and pH. Presence of pus and tissue debris and body secretion decrease the efficacy of most of antimicrobial agents, especially sulfonamide and aminoglycoside. Hematoma is a favor the bacterial growth and impair the activity of certain antimicrobial agent. And pH of body fluid is also determine the efficacy of certain drug. For example, of the aminoglycoside more active in alkaline in nature. Age, hepatic and renal elimination process are often poor developed in the newborn and older age animals is also affected. Species differ in their ability to elimination of the antimicrobial or are susceptible to the adverse effect of the drugs. Pregnancy antimicrobial should be avoided in pregnant animal except when essential required. Because of that, these drugs are cross the placenta. And genetics factors, certain genetic abnormality must be considered while choosing the antimicrobial agent. Now we see the combination of the antimicrobial drugs. The combined use of the two or more antimicrobial drug is consideration certain required to treat the certain infections. To broaden the spectrum of antibacterial activity, to treat the mix bacterial infection in which all organisms are not susceptible to the single antimicrobial drugs, to achieve the synergetic antimicrobial activity against the some resist strain of bacteria, to prevent the emergence of the resist strain of bacteria, to minimize the toxicity of an antimicrobial drugs. Guideline of the combination of the antimicrobial drugs. As a general rule, combination of two suicidal drugs are often synergetic, whereas combination two static drugs are additive in nature, and combination of the suicidal drug with static agent often result is antagonism. Now we see the prophylactic use of antimicrobial agent to prevent the infection in dirty contaminated wound, to prevent the infection after the surgical operation, to prevent the postpartum infection after normal perforation, prevent the secondary bacterial invasion in viral infection, to prevent the infection in disease outbreak, to prevent the infection in endemic area with higher transmission rate. Thank you.